Let's talk about GLP-1 medication in cancer, and this is huge. Several studies have been published from serious journals showing that patients with certain types of cancer that are also using a GLP-1 medication have less tumor burden, less recurrence of their cancer, and higher survival rate. And this has been shown with breast, colon, pancreatic cancer, thyroid cancer, and certain types of lung cancer, and also liver cancer. Now, what's the relationship between a GLP-1 and cancer? But we need to backtrack, and I'm going to try to simplify it. But one of the biggest drivers for cancer, or for cancer cells to proliferate, to multiply, is inflammation, insulin resistance, and hyperglycemia. These metabolic changes can increase the risk for certain types of cancer, and if somebody has cancer and they have this going on, it's causing chronic inflammation. So why is inflammation? We hear so much about it. When our body is in chronic inflammation from the things that I mentioned, and visceral fat is a huge one. Remember, visceral fat, insulin resistant, hyperglycemia. This causes chronic inflammation in your body, meaning your immunity, the things that protect you, are preoccupied with visceral fat, hyperglycemia, hyperinsulinemia, insulin resistance. That leaves other things that could harm us with an open door, right? And we're talking about cancer cells, we're talking about viruses, we're talking about bacteria, talking about viruses, COVID. This is why patients with obesity have higher risk or higher mortality with COVID, with obesity, because of that chronic inflammatory states. Now, hyperglycemia, glucose feed cancer cells. So if you think about it, what GLP-1 comes and do, which is all anti-inflammatory properties, then your immunity is freed to attack other things, including cancer cells, right? So there's a study, which I put the reference here, that shows that they studied if there was a direct effect of GLP-1 in the cancer cell, and this is in lung cancer, and there was no shown direct effect in cancer cells. But in the mice that had the lung cancer with obesity on a GLP-1, their recurrence was low and the outcome was higher. So it's more, what it seems, an indirect effect of GLP-1 in cancer. So are you surprised? I'm not.